This is Dr. Girish, a professor of epidemiology from NIMHS, Bangalore. The National Mental Health Survey is globally the largest survey being undertaken in India. This is supported by the Ministry of Health and Family Welfare, Government of India, and implemented by National Institute of Mental Health and Neurosciences, Bengaluru. The biggest characteristics or feature of the survey is this is being undertaken as per the ICD-11 and is the most scientific survey being undertaken globally. I take this opportunity to thank the UT administration for all the support, cooperation and guidance which they have given. We will come back with an action plan which is more suited for developing a mental health care and enhancing it in the UT of Andaman Nicobar Islands. Thank you.
Good evening, all respected dignitaries and stakeholders, and also the co-principal of Mental Health and Neurosciences, supported by the Ministry of Health and Family Welfare. So we will be having the Mental Health System Assessment Consensus Workshop.
It is our pleasure to welcome all the stakeholders, Ms. Hemlata, Psychologist, National Health Mission, Andaman Nicobar Islands, Ms. Nidhi Prakash, Clinical Psychologist, Telemanas, Ms. Kavita Ravi, Clinical Psychologist, Triangle, Shri Mandeep Grewal, Founder, President of NGO, Guru Ki Rasoi, Shri Abdul Rashid, Director, Rashan Rashid Foundation, NGO.
Disciplines or the line departments, I think is something phenomenal. Also would like to take this opportunity to convey the thanks of the Ministry of Health and Family Welfare because the National Mental Health Survey is the largest survey which could happen globally.
I now invite Dr. Samar Hussain Ma'am, Associate Professor, Department of Community Medicine and the Co-Principal Investigator of NMHS-2 from our islands to brief us about the NMHS-2 and its implementation in our islands.
So here I am to take you through the National Mental Health Survey 2 conducted in Andaman and Nicobar Islands for the first time along by the Departments of Community Medicine and Psychiatry. As unique as Andaman and Nicobar Islands is, the indigenous population clusters needed to be there for the tribal representation. So they were sampled proportionally as well from the tribal districts to ensure the adequate representation, which is quite different from the other states and UTs across the country. So once we were done, we had a total of 170 clusters spread across the 3 districts of islands. And the total interviews conducted in Andaman and Nicobar Islands were 7,476.
So coming back to the National Mental Health Survey, I must also mention that Professor Rao mentioned it's a huge exercise being done all across the country, and it's of a historical importance because nowhere in the country and nowhere in the world such mammoth exercise has been done as regards to mental health. And all the survey data that we are going to get, we will be better able to plan how the mental health of our islanders is faring and where our interventions. Again, congratulate my team, and I hope during the systems assessment we are going to get a very good idea of where the islanders intra and the interventions stand. So I again congratulate each of the participants for this amazing exercise in the National Mental Health Survey. Thank you so much.
We send the data to the NALSA. Yes, how many cases are there? They were reported and all.
Yes, sir.
And what step we have taken?
Yeah, all states Their adolescents 13 to 17 was a pilot study, now it is a full-fledged study. We are looking at children. One thing what we want to...
That will be there. But we will talk about...
And concern child care.
Andaman Nicobar Islands we are talking about. Just talking kindly about the CCA. That is also on ground reality point. We don't have. See, just that is a pilot. So we are just sharing our thoughts. Like what
Sure. Now you have suggested 4. All of you agreed 4 as a score for that?
No sir, we always tell the chief CMO store to send the medicine for 3 months and we keep it buffer stock also.
Okay, then we have 4.5 sir, because the sir is always available. The team is always available.
Yeah.
4.5, or would you put it as 5 question? One of the things is also with respect to training police personnel.
So this has not been done, I can say.
Okay.
We also place on record our special thanks to the Member Secretary, State Legal Service Authority for valuable support and collaboration extended towards the legal awareness initiatives related to mental health. In the end, I would like to extend my sincere appreciation to the organizing committee, technical team and support staff whose dedicated efforts and meticulous planning ensured the smooth and successful conduction of this workshop. The recommendations and perspectives emerging from today's deliberation will significantly contribute to strengthening the mental health care services